Diane and Gemma, How Does It Feel for Me? September 2025, Part 2. In this video, two services are mentioned, DAOs and occupational therapy. DAOs provides BSL on-demand interpretation via video call, as well as pre-booked face-to-face interpretation, allowing deaf people to communicate with GP services. Occupational therapy helps people to stay independent by providing advice, equipment, and home adaptations to make daily life easier and safer. Since we last spoke, has there been any changes to the medication you take?
Talking about tablets for my blood pressure. My husband went to collect the most recent order, and they said that this specific medication was out of stock. They said you need to make an appointment to see a doctor to give me new tablets. And they said it's going to be about 2 or 3 weeks' time to arrange that.
It was only delayed because needing an interpreter. And so they ended up waiting, they replaced the order and they managed to, the item was back in stock, so they managed to get the tablet just as my mum had run out. But it is quite dangerous, like that, you know, that this isn't my mum's blood pressure medication. And, you know, if she didn't have it, that could be quite detrimental. I received a random phone call from a mobile number, not a landline, and when I picked up, it said he was a pharmacist and that he wanted to know how my mum was getting on with new tablets. And as far as I was aware, as far as my mum was aware, she wasn't taking new tablets. It's the usual thing. He has to speak to my mum. I say, this is her daughter, my mum's deaf. And he was asking me, how's my mum feeling? Has she got any side effects of this tablet? And I sent my mum a message. She actually had no idea about this tablet change at all. She's been on the same tablet, so she was really confused. I was really confused. And I was, reiterating, well, she's deaf. She's got an email address. Can you contact her by email? And they said, no, telephone's the only way. They said he'd call me back in a month's time, and it's not happened.
So much information can be a bit overwhelming. I always rely on Gemma to break things down and explain things.
And it's quite scary because like this new medication had like a whole list of side effects, and he was like, oh, you need to watch out for having muscle pain, and she can't have oily foods, and it's all got these certain restrictions. And like there's no way for me to sort of measure that in my mum, especially if I'm not around her. I shouldn't really be relied on as a carer. It is difficult to sort of arrange my time to meet the time that's been set for my mum's appointment, and I don't want her care to be sort of pushed back because I couldn't make it. Like, I don't want to be the cause of my mum's health getting worse.
Since April 2025, GP surgeries in Leeds have had a new provider for video interpreting called DAOs. What has your experience been of them?
So I've been to the doctors and requested an appointment. I had them rely on writing information down to communicate with them, but I've never been offered the service of a video relay interpreter.
For my dad's experience of having sort of the video interpreting service, it was useful in that you can get a video interpreter there and then when you might not necessarily get one face to face. But it took like 5 to 10 minutes to connect to an interpreter. I know sometimes from video calls with deaf people, it's sometimes hard to see what they're saying, like because it's a smaller screen, you can't necessarily lip read that well, or sometimes the hands might get out of shot and things like that.
Sometimes useful. So the appointment with the diabetes nurse, yeah. Sometimes the interpreter was freezing on screen.
What can GPs and other services do differently to make sure communication is clear and accessible for everyone?
Video will be helpful with this. It will be quicker for me and for my husband as well. They should have a webcam ready when I arrive. If I need to make an appointment with the doctor, hang on, video webcam on. That'd be very useful for deaf people who came.
Like actually listen to what the communication needs are, record it, and then actually respond accordingly. Like if it flags on the system that my mum's deaf, get an interpreter and let her know that one's provided, because it's not always expected that there is one there as well. If they just put on the letter, there's an interpreter booked, and that sort of gives my mum that relief, and it means that we don't have to chase up and keep calling the hospital or wherever to try and get one.
What have you valued since we last spoke?
My parents had a referral to sort of get support in their own house, so occupational therapy, community occupational therapy, and they've sort of provided different things for my mum, so the walker and sort of looking at putting different rails up around the house and outside the house, and they're now looking at building a ramp outside the front door to help my mum get in and out of the house. And I think that service has been quite good. Like they've been texting my dad to sort of let him know when they're coming and when to expect them, which is really positive. And it seems like sort of they're moving on and getting the next steps and continuing to sort of double check, okay, well, how can we make the house more accessible for my mum to get around?
If you would like to share your story, please contact Healthwatch Leeds. Telephone 0113 898 0035. Text phone 07717 309 843 or email info@healthwatchleeds.co.uk. Thank you to Diane and Gemma for sharing their story. Produced by Healthwatch Leeds in collaboration with Roe Lara. Diane's voiceover by Rita King Davis. British Sign Language translation by Sidra Ahmed.